Uh, yes, sir, you have to cut the ribbon. Join us to celebrate a significant milestone of the journey of the excellence at Shalby Sanar Hospital, Gurugram.
I am the CEO and VP of AACI America. AACI is American Accreditation Commission International. It's an organization based of USA for the last 10 years. And we are expanding globally all over the world doing international accreditations. So when we talk about international accreditations, the overall expansion of the healthcare globally.
As we are honored to have you today, we are proud to announce that Shalby Sanar Hospital is the first hospital in Gurugram to achieve this AACI accreditations. And we are so proud that we are honored by the AACI. Thank you, sir. Safety and clinical excellence. It marks a new chapter in serving the community with the world-class healthcare excellent services. We invited you to join us to the accreditation ceremony, a symbol of this accomplishment as continue our pursuit of excellence. I thank Shalby Sanar management for their continuous support and encouragement. I would like to invite Mr. Naresh Kapoor sir to say a few words to us. Thank you, sir. Please come.
Thank you. Thank you, Atulya. I welcome my dear friend Mr. Dheeraj and the colleague. As we are being recognized as the first hospital, and the prestigious accreditation is tremendous honor for us, sir. Thank you so much for this. At Shalby Sanar, we believe that the quality is a journey and it's not a destination or it's not one-time thing. It's an ongoing process where we strive to bring quality and maintain the quality, which is more important. Once the accreditation is done, it's not that we have achieved whatever we wanted and after that we put it at the back burner. No, it's a continuous process and we will always continue to maintain that standard and in fact achieve further standard, as I was discussing with Dheeraj that there are certain more accreditations which are coming up from AACI and we would like to be part of that also. So as we accept this certificate today, we do so with deep sense of responsibility to maintain the standards set by AACI. I would like to extend my heartfelt gratitude to the entire Shalby Sanar family and all of those who has put in the hard work. All my team members, colleagues who have been for so many days and months have been at their
Team support, and definitely from my all the respected consultants, my staff, my core bodies, because for everybody, sir.
Showcase our hospitals also have standards to the international levels. So this is for everybody. This is for domestic patients, international patients, has a healthcare industry as such for doctors, nurses, and everybody working together. So this is our mission, and what we say is ruling risk, saving lives. So anybody coming to the hospital has higher risk of getting other things rather than sitting in an airplane. Okay, so that is where we come in the importance of international accreditation. So we are the only two bodies in India right now doing international accreditation in the scale that we are doing, and we have achieved more than 15 hospitals in 2 years, and Shalby Sanar is our latest client and more to come. So we congratulate Shalby Sanar on the behalf of AACI America. I am board member, so that is a special feast that AACI to make the hospital better. So this is not just a certificate that if you see, of course, we are doing the ceremony today, but it's the achievement that they have to work hard, they have to maintain it. And AACI is the only organization which comes every year, even though we accredit them for 3 years.
It is for you to the first hospital in Gurugram, sir. Thank you, sir.
the overall hospital infection control to have an international accreditation agency which improves our systems and processes, and wherever there are some areas where we can improve, they provide us for that scope for improvement, and we do.
What hospital needs to have center be required to achieve this accreditation?
So it's like the program we are running here, it is very high-end program where we do a lot of transplantation like liver, bone marrow, kidney transplant, neurosurgery, spine surgery, very high-end cochlear implants and other surgical programs. So we require our systems and processes and protocols to be at the international level where the patient outcomes are controlled by that, and where it not only affects the patient outcome but also the overall reputation of the hospital, where somebody else from outside and from America is coming here and giving us validation for the hospital systems and processes, and also keeping a check on that, like Mr. Dheeraj mentioned, that every year they do this visit. They visit us and they see that the systems and processes which were there at the time of accreditation are maintained. So that is how it is very important.
So it is for the
Yes, but every year they validate that.
okay.
So as I said, American Accreditation Commission International is one of the fastest growing, most experienced organization. Globally, all over the world, we have done 350 accreditations. Last 2 years, I have been running AACI in India, and we have done more than 15 hospitals. So what happens with the hospitals is we check whether they want to elevate their standard from national to international. Of course, you know, healthcare is very dynamic, so require a lot of process change. And this is where we ask them, how does your hospital validate to an international standard? So from our process, we have a 3-day event. We come here with 6 surveyors. We sit and do all the process. We do interviews. We check all around the hospitals. We go to all the departments. We have 30 standards to check. And that is where we come to know that hospitals have achieved the required levels. And as said before, we accredit them 3 years, but AACI is the only organization which checks them every year. So this makes sure that the certificate validity and they are serious about what they have achieved. And this is an ongoing process that we see. So any patient coming from national or domestic or international wants to achieve a better quality for the money he's spending. So that is where medical tourism comes, that is where patient quality and safety comes. And as such, India is growing as its biggest market of healthcare. So I believe accreditation is very important for us.
How many hospitals in India have achieved this accreditation?
So we started our journey from July 2022. This is the 15th hospital we have covered in 2-year time. And our hospital also include bigger chains similar to Shalby. We have Max Hospitals 3. We have KIMS from Hyderabad. We have KD Hospital Ahmedabad, SCG group of hospital. We have a hospital from Kerala with Muthoot Group. So Shalby also has one hospital from Ahmedabad, which is going to be next accredited from us. So we already have bigger chain, the top 5 chains. We have 2 or 3 of them with us, and also individual hospitals.
government
So the standards, it's not easy. We won't blame because the number of patients they see is not small.